Hello, good day. My name is Marla Asis, Director of the Scalabrini Migration Center. Thank you for joining us in today's webinar on the theme COVID-19 and Migration Interrupted, Policy Reset and Prospects for OFWs. This webinar is a joint initiative of the Scalabrini Migration Center and Hiroshima University. The webinar series is part of a multi-country research project comparing the mobilities, representations, and social relationships and among Filipino migrant workers under the pandemic, led by Dr. Itaru Nagasaka of Hiroshima University. The research will be undertaken in Belgium, Canada, France, Japan, the Netherlands, and the United Kingdom. As an initial activity of the project, this webinar focuses on how the COVID-19 pandemic impacts on the Philippines as a major country of migrant workers for the global labor market. Many webinars have actually been conducted on this question. What we hope to contribute to the ongoing reflection is to see how the Philippines has fared in dealing with the unsettling and disruptive displacements of the pandemic on policymaking on key aspects of managing labor migration during this uncertain and volatile time. We also want to explore the personal and social challenges of reintegrating the OFWs who have returned and the psychological toll of displacement and navigating reintegration. We will examine these questions with a time lens. That is, with the recognition that we have been dealing with the pandemic in the last 18 months. At this point, these are the things that we know. Deployment levels in 2020 are 75% lower relative to those in 2019. Overseas employment prospects are still uncertain. With a continuing slump in the global economy, there has been little change in the demand for workers in tourism-related sectors, sales, manufacturing, and construction. There was a contraction in the volume of remittances, but it is less than 1% compared to the 2019 remittance influx. It is actually much less than the 20% that was anticipated in the early period of the pandemic. Our experience thus far invites us to reflect on what we have learned and what we need to reconsider and rethink to better respond in a context where overseas employment opportunities are still bleak and where economic prospects at home are equally challenging. Co-facilitating this webinar with me is Mr. Ricardo Casco. Rick is a longtime colleague who has a wealth of experience and wisdom derived from his many years of working at the Philippine Overseas Employment Administration, the International Labor Organization in the Philippines, and the International Organization for Migration in the Philippines. He retired from IOM Philippines, but he continues to be involved in migration-related endeavors. Hi, Rick, and welcome.
Yes, thank you, Marla, for having me as your co-facilitator, and good afternoon to all the participants. Congratulations on this webinar research discussion. It is very timely.
Yes. Rick, do you have a sense of deja vu about the various issues that we are facing now? Does it make you remember what you had gone through when you were still very active in POEA, IOM, and ILO? All these issues about reintegration, repatriation, and so forth.
Oh, definitely. Precisely because my last two projects, when I was UN Family, involved migration crisis management and preparing the Philippines improve its reintegration program, no, in terms of policy and service delivery system, no. And at the same time, at the personal level, I have been in touch with forced returnees who seem to believe that they have depression and asking how to go around and go about their life now that we have a very difficult situation home. No? Okay. So it's very, very intimate to me and very relevant.
Yes. Are there things that you are looking forward to in our discussion today?
Well, I guess I'm in aspiration for continuing learning, and so from the perspective of independent experts who have spent much time reflection in the academe, in the research circle, which normally is not very easy to have when you are in public service. You are
Mm.
on a day-to-day concern and day-to-day operation. Hopefully, I will learn from the third eye of these experts who see the whole picture because they are outside the frame.
Okay, thanks very much, Rick. So actually, our format this afternoon is pretty straightforward. First, we will hear from our invited speakers, three presentations, and then this will be followed by interventions from our discussants, and we will have ample time for the open forum. With that, maybe we can start the conversation going with insights from our speakers. So, as mentioned earlier, overseas employment prospects thus far and in the near future are not very promising. There is continuing demand for seafarers in merchant vessels, and there's also demand for healthcare workers, especially nurses. But while seafarers can leave the country, the government's policy concerning healthcare workers, and particularly nurses, has generated a debate on national interest, the right of individuals to migrate, and beyond migration questions. The pandemic has also highlighted anew what ails our healthcare system. Dr. Yasmin Ortiga, Assistant Professor at Singapore Management University, will share insights on these issues in her presentation. Her research delves into how the social construction of skill shapes people's migration trajectories, changing institutions within both the countries that send migrants as well as in the destination countries. In 2019, she received the National Academy of Education Spencer Foundation Postdoctoral Fellowship. Her work has also been published in Global Networks, International Migration Review, and Discourse, Studies in the Cultural Politics of Education. So I now invite Dr. Yasmin Ortiga to make her presentation. I think you have to
Hi,
unmute.
sorry. Yes, sorry. I made that mistake. So I'm just going to share my screen, but it seems that it's having some difficulty. Let me try again.
So maybe while waiting for Yasmin to share her screen, I would just like to thank our online participants for joining us today. And actually, from the list of registered participants, we have participants coming from other countries. Of course, aside from the Philippines, we have participants joining us from Korea, from Japan, quite a lot from Japan, Finland, Italy, Taiwan, New Zealand as well.
Okay.
I wonder if
Yeah, so sorry.
no,
I
it's
can't
okay.
seem
It's
to share
okay.
my screen. So I think if the tech team doesn't mind sharing my presentation for me, I could just.
Yes, yes. I think Dax can do it for us. Yes.
Sorry about that.
No problem. Yes.
Okay. Okay. And good save, Marla, by saying something during that awkward moment. So, good afternoon, everyone. Thank you for giving me the opportunity to share my research in this workshop. When Marta invited me to present my research, I remember that we talked about how the pandemic had given us a new vocabulary of words to make sense of our experience, both in Tagalog and in English. So we have words like lockdown or phrases like flatten the curve. And for those in the Philippines, the ever present, ayuda. But I thought that today it would be nice to talk about a specific word that has become quite contested, especially for Filipino nurses, and this is the word or the term essential skill. So that will be the focus of my presentation today. In the next slide, I'll show that actually this project is based on a larger research study that looks at how the pandemic disrupted two ends of the Philippines labor export system. So for today, I'm focusing on only one part or one end, which is the deployment of health workers abroad, and the deployment ban that the Philippine state had instituted to kind of redirect them towards local hospitals. Okay, next slide. So let me just say a bit about where our data is coming from. My collaborators and I began this project in the middle of the first lockdown here in Singapore. It was April 2020. And we interviewed two groups of migrants. So aspiring nurse migrants, as mentioned earlier, who were affected by the deployment ban. And then actually the second group comprised service staff from the cruise industry who had been repatriated to the Philippines after losing their jobs on their ships. We also supplemented these interviews with a document analysis of news coverage from 2020 to the present. But this presentation is only based on the interviews with nurses and the document analysis. Next slide, please. So as most of us are aware, before COVID-19, the Philippines took a lot of pride in being the world's primary source of migrant nurses in the world. Catherine Sinisa Choi wrote a rich history of the development of the profession within the country and how colonial ties established migration pathways between the Philippines and the US. Ana Romina Guevara showed how the movement of nurses had been reinforced and facilitated by commercial agencies. And all of these groups were also enabled by the Philippine government itself. Much of this work, including my own, investigates the problems that occur when nurses are treated as commodities for export and what gets lost in this process of just facilitating their migration overseas. Next slide. But as audience members from the Philippines are well aware, the COVID-19 pandemic brought about new pressures and problems for the Philippines export model for nurses. So you see here that throughout March, there was all this relentless news about overwhelmed hospitals and how the pandemic was straining the country's healthcare system. Next slide. All of this led to increasing criticism against the Department of Labor and Employment for allowing the deployment of nurses from the country. So one especially controversial report, I don't know if people remember, featured a German hospital group that managed to fly out 75 Filipino nurses to the state of Hesse. The Germans have obtained a special permit to transport these nurses on a recruitment flight out of the country. And the German foreign minister himself had work visas delivered by a courier from the German embassy to each nurse's home, thus facilitating the paperwork for departure in the middle of a national lockdown. So this report caused a lot of uproar in the general public and prompted a number of politicians to call for a stop to the country's labor export activities, especially for health workers. And so suddenly, Philippine government officials found themselves faced with an unusual dilemma. After decades of aggressively deploying Filipino nurses overseas, the labor exporting state needed to redirect these workers towards healthcare institutions at home. Next slide. So then the question is, how do they do that? A big buzzword during the pandemic was this idea of a pivot. So to pivot is a management term for drastically altering the direction of a business given the changing circumstances of the market. During the first few lockdowns, public discussions were always about how restaurants can pivot to take out from dine-in, or how theater companies can pivot to Zoom from live audiences. Looking at the case of nurses in the Philippines, I wondered if what we were seeing was the state's version of a labor export pivot. In many ways, the Philippine state also had to completely change its own business model during the pandemic. So then the question again is, how? Next slide. My argument is that Philippine state officials tried to pivot its nurse migration policies by reconstructing the purpose and meaning of nursing skill from export product to a national resource too essential to let go. Next slide. So in particular, the Philippine state used the discourse of essential skills to justify a resolution banning individuals from health-related occupations from exiting the country for overseas work. So the list included a wide range of professions, from doctors to microbiologists, but nurses constituted the largest group, with hundreds unable to leave for jobs waiting in the UK, Germany, Saudi Arabia, and Singapore. This deployment ban was not the first time the Philippine state had prevented its own citizens from leaving the country. As Marla and Sir Rick probably know, in the past, state officials had prevented the movement of Filipino workers to specific countries after particularly heinous cases of abuse. In fact, shortly before COVID-19, the Philippines had banned the deployment of all migrant workers to Kuwait after a 26-year-old Filipino domestic worker was brutally murdered by her employers. But what made this deployment ban different is suddenly, instead of just a means of protecting Filipino migrants' welfare in a particular country, the health worker deployment ban was framed as the government's right to retain skills deemed vital to the country's COVID-19 response. The actual resolution used the term mission critical skills. The deployment ban would allow the Philippine state to replace, substitute, or reinforce mission critical skills as local hospital workers fell sick or were placed under quarantine. So, in using skills as the only criterion for determining who was covered by the ban, the Philippine state basically terminated the outflow of health workers to any nation beyond Philippine borders. The ban also blocked all possible pathways that Filipino workers could take in leaving the country, Filipino health workers. So they halted the deployment of commercial recruitment agencies as well as bilateral agreements between the Philippines and other nations. Next slide. So, to clarify, the logic of the deployment ban is not necessarily wrong. Why would you export health workers when you have a public health crisis at home? However, the blanket term of mission critical skills was problematic from the start. Immediately, individual nurses asked whose skills should be truly contained within the country. A week after the Philippine state announced the deployment ban, a group of 20 nurses were prevented from boarding their UK bound flight at Manila's International Airport. Most of these nurses had already been working in UK hospitals for years and they were only visiting their family when the lockdown occurred. In official terms, they were balik manggagawa or returning Filipino migrant workers. But when they tried to explain the situation to airport officials, they were told that in declaring all nursing skills as mission critical, the assumption was that all nurses were covered by the ban. So desperate, individual nurses called in the Philippine state to explain, shouldn't some nurses be allowed to leave? So if you click the presentation, what we have here is a quote from Marlo, a Filipino nurse who was working for the British NHS and was just in Manila to visit his family after he had emigrated in 2017. So here he's saying that, we have bills to pay in the UK because, that's where we actually live. And so after much protest, if you click the presentation again, the state enacted an amendment that, okay, only newly hired nurses will be prevented from leaving. And so those who already had existing contracts overseas would be allowed to leave. So this was the first tension that we see. However, it quickly became apparent that the category of new hire included a wide array of nurses. So some nurses were truly first timers in that it was their first time going through this process of leaving the country. Yet, for nurses like Micaela, her status was more complicated. She had signed a contract with the British NHS as early as December 2019. At that time, she was working for a private hospital in the UAE and had the option of traveling directly to the UK. However, she wanted to spend a few months with her 8-year-old daughter, who had been under the care of her mother for the past 3 years. As such, she resigned from her UAE job and returned to the Philippines for what was supposed to be a 2-month vacation. So technically, Micaela is considered a new hire because she's starting a new job with a new employer in a new country. However, for Micaela, she's not a first-time migrant. Having worked abroad since 2017, she was completely unprepared to be stuck in the Philippines for an extended period of time. So here she explains her situation. She says, I'm not like one of those nurses who are leaving for the first time. They can just go back to their former employer here and say they want to retract their resignation because of the ban. My former employer is in the UAE. They even called me to ask if they could help, but then there's nothing really they can do. Okay, next slide. Oh, and there you see that. And so the amendment here was that they said, okay, maybe when we say first timers, it means that if you have a perfected contract and OEC before March 8th. Okay, next slide, please. So then the next question, even among first timers, was at what point can we consider a nurse too far along the migration process to be prevented from leaving? So, in other words, when is it fair to say, since you had not left the country yet, maybe it would be good for you to serve the Philippines first? So, when is it fair to say that? And here you see that the initial cutoff date of March 8th was difficult for nurses to accept, especially for Chester, a nurse who had completed all his paperwork on March 12th, 4 days after the deadline. By the way, March 8th is a Sunday. That's another painful point for the nurses. Chester had resigned from his job, he obtained a work visa, and he scheduled his flight out of the country to be told to do a U-turn and go back to his hospital job is understandably difficult to swallow. And so after much protest from nurses themselves, the state had to amend the ban again and they extended it. If you click the presentation, they extended it to August 31. And this goes on and on until our current situation where what we have now is a cap on the number of nurses who are allowed to leave. I think it's about 6,500 currently. Okay, next slide. So to appease nurses, state officials emphasized that the ban was only temporary. For a period of time, can Filipino nurses put bayan before I? So bayan means country. So in other words, can you put the country before yourself for a limited period of time? In many ways, this appeal definitely comes from a place of justified need, as Dr. Joel will tell us later on. Yet, in appealing only to nurses' selflessness, the call for nurses to temporarily contribute their skills to the nation fails to recognize the time-sensitive nature of applying for overseas work. Nurses were anxious that the ban would outlast the validity of their immigration documents, all of which were expensive to obtain. So one thing that everyone knows but doesn't really talk about is how, in order to migrate, your skills have to be certified. And all those certificates have a time limit in terms of when they are recognized. Just to get your transcript approved by a foreign country can cost hundreds of dollars. Then there's the IELTS exam, which certifies your ability to communicate in English. That's another $200. And if you live outside Manila, submitting papers to a recruitment agency would mean paying for courier delivery, domestic air tickets, bus tickets, all these expenses, involved in going through the immigration process. So as you see here in this quote, Elmer, a nurse, says that, time is not a luxury that they have, mainly because the recognition of their skills has an expiry date. So in the last slide, you've seen in my presentation that, attempts to control nurses' movements based on their skills have generated multiple tensions, conflicts, and contestations. So to be fair to the Philippine government, there are other countries that have imposed some controls on their health workers because we're in the middle of a pandemic. I remember reading an article on how Taiwan required its medical doctors to seek state permission before leaving the country. So it seems like it's not unique to the Philippines. But what makes it so tricky in the context of the Philippines? I argue that the country's history as an exporter of nurse labor makes it difficult to pivot migration policies simply based on a discourse of mission-critical skills. Much of the controversy surrounding the nurse deployment ban revolved around the question of whose skills could be justifiably retained for the country's pandemic response, whose movement is deserved, and whose immobility is essential. All this time, Filipino nurses have simply asked for a labor export pivot that is more nuanced, more fair, and more sympathetic than just a blanket attempt to retain mission critical skills. In the end, rather than label nurses as selfless or selfish with their skills, perhaps what we need is a stronger push for migrant sending states like the Philippines to justify their labor pivots. And to be honest, I don't think it's too hard a request to ask for. Thank you very much.
Thank you very much, Yas, for that great presentation. And I just want to bring Rick in because perhaps Rick would also remember when he was still with POEA, this whole concept about mission critical skills. I wonder if you have some um, past discussions about this, Rick, and what you think is very different from how the government has dealt with the issue of nurse migration at this very critical time.
Yes, definitely, Marla. And thank you, Yasmin. You've been so stimulating, intriguing, especially for a guy like me who spent 20 years in POEA and 10 years of that at the helm of market development, no, for overseas employment. No? Well, first of all, the reference to labor export, no, is something that I am not at this point in time, and since several years ago, even if I were in marketing, was not comfortable not to use, no,
Mhm.
um, because migration was to government for a long time was a matter of really uh, constitutional choices of citizenry, no, and when they so make that choices, it is the obligation of the state, no, to protect them and to facilitate, not to overregulate and make it hard for them to seek those opportunities, especially when they are not home. No, so it isn't something to me like you export sardines or bananas na you can pack them and unpack them or like stop them being delivered anytime at your whims. No, and it is very enlightening to see the perspective of Yasmin's research, no, because it puts together many things how they could really relate all these issues and values, no, and it only reminds me that migration, not that I defend government, no, migration governance will necessarily have to be really um, dancing and like strutting as the market demands. So it cannot just stick to ban now. You never soften. No, they soften because they listen, and they realize after a while there are other things and other issues, and that's why these courses need to come. No, now on this mission critical skills, this is not an invention out of the pandemic. No, it's been a long time. No, that I was still in POA. Can you imagine? I was already away from POA from 16 years ago. We have already been part of our policy then was really to make sure that in the interest of the state, and when our own industries, and our sectors so demand, and when the stakeholders so demand that there should be some stop or restrictions, then we must respond, and more so now that the threat is not just the hospital industry, not just the doctor association or nurses association. It is the whole Philippines, because of the threat of the pandemic, and true that many times we stop deployment abroad because of welfare cases, vulnerability, but then there were times we also slowed down on the deployment of welders, because our own um, our own companies are complaining how they could compete in international contracts when they cannot hire their own Filipino welders, the skills, And so this is where the importance of the skills belong, not just a matter of possession of the professional individual, but of a juridical and corporate personality, There was a time we also curtailed deployment of pilots, and I think airplane technicians were declared as mission critical skills. So, in fairness to government, I think there is that obligation, and it cannot be insensitive to the needs, especially if there is a crisis among certain stakeholder industries and sectors, And I also like to mention that these are talking about that this is really a dilemma, and the dilemma is made more difficult because the government um, is unclear as to where to put those nurses they retain or stop deploying abroad. No, for example, as Yasmin said, they already invested a lot of money and resources to a contract that could be promising indefinite employment. No, especially if you go to countries like UK and America. No, and the thing about it is, where do you put them here? They're being offered 3 months job as against their prospect of a 2-year contract or more. No, what hospitals? No, this is this brings us to the more basic problem about our competitiveness, our own local market. No, our if you want to prevent brain drain, we need to really create the platform in which they can really practice their profession, and pay them decent wages, make them more competitive. So it's very interesting. I like the way you have written about it. It stimulates a lot. And what worries me really is about as government ensured to maintain that there is institutional memory, in how it manage migration in the different types of crisis, in order to be able to articulate and explain itself to the public, because sometimes you just make a pronouncement, and it's not very well argued, on the basis of experience on similar situations. You can
So perhaps
speculations.
Thanks, Rick. No, we will also hear from Dr. Joel later, especially, I guess, from the perspective also of health. But also one of the things that was raised in Yasmin's presentation is the different understanding of government terminology. Like what is new hire from the perspective of POEA, and what is new hire from the perspective of our nurses. So I think it's also time. So thanks very much, Yas. I think it's also time to move on to our next presentation. Rick, would you like to introduce our next topic and our next speaker?
Oh, yes. Okay, give me a second.
Coming up.
Coming up is a presentation by Miss Katrina Frances Chang. No? Before I introduce her, the pandemic raised many concerns about mental health. No? And what were the concerns specifically of OFWs and their families during the pandemic? No? What were the profiles of OFWs and their families, who sought psychological assistance? How did Ugat Foundation reach out to those in need? What are the possibilities and limits of online counseling? And so, with all these questions, we will have Katrina of Ugat Foundation. She is the program manager, to share her experiences and insights as caregivers. Ugat has cooperated with the POLO, the labor attaches offices abroad all over, on a variety of topics on mental health and homesickness, which have been a recurring theme in the migrant context. When the pandemic struck, Ugat was one of the first organizations to offer online support to OFWs through the Ugat Sandalian link. So, ladies and gentlemen, let's have the floor for Miss Katrina Frances Ching. Kat?
Hello po. Good afternoon. Thank you for that very nice introduction, Sir Rick. And good afternoon to all of our participants and viewers from all over the world. I'm here to represent the Ugat Foundation and to report to everyone and to share about the mental health status of the OFWs that we have encountered with this year. So let me just share my screen really quickly. I hope that everything is being seen now. And please just call my attention if there are a bit of technical difficulties, but I think we're all good. So let's just proceed. So I'd like to report a little bit on what our experience is from the Ugat Foundation with the OFWs during the height of the pandemic and up until now. So again, my name is Katrina and I am the head of programs of the Ugat Foundation, but I also double as a facilitator, a workshop facilitator and a counselor to the OFWs and also to the Filipinos as well. So let's get moving. Let's get cracking to it. So the Ugat Foundation is actually an acronym for Ugnayan at Tulong para sa Maralitang Pamilya Foundation in Tagalog. That's in Tagalog. So in English, it roughly translates to connecting and helping for the grassroots families. Okay, because we are a Jesuit apostolate for grassroots families, and the foundation has been founded by Father Nido Tanalega, a Jesuit priest in 1991. He is also a marriage and family therapist and has been a lecturer in the Ateneo de Manila University Psychology Department. And he has been traveling all over the world to hear and to listen to the stories of Filipinos all over the world. So our approach is very much systemic and uses psychological interventions that have been tailor-fitted to the needs of the Filipino families. So we all know that the Filipino culture is very, very family-centered, and this is a very nice look into how a person relates to another with the lens of the systemic approach. And with that, evidence-based interventions and models are also accompanied with this systemic look. And our main thrust is to really assist this individual and empower them, to strengthen them, no? To show them their capabilities and to empower them to change from within. And from there, that can really take on and have that ripple effect within the system. So let me just share a bit of some of our partners that we have worked with all throughout the year. So we have with OWA, the Overseas Labor Offices, also the Scalabrini, also we have a very close relationship with them. A cooperative network here in the Philippines, which has a regional reach, and also the Blas F. Ople Policy Center. So to introduce a bit of our psychological services and why we have come to know of the plight of the OFWs, Sir Rick has introduced one of our services, which is the Ugat Sandaline. This is a free crisis line that was revived because of the pandemic. Father Nilo found that there was this great need for psychological services, and the online platform really gave that accessibility, not just for Filipinos here, but also regionally and also internationally. As you can see from the poster here, there are different time zones that signify when the crisis line is available. And that gives the OFW more freedom to adjust on and to also see what times they are available to have someone to talk to. And with that, we have used platforms that are very Filipino accessible, which means that Facebook Messenger is greatly accessible to the Filipinos now because the chat function is actually free. So there's no need to spend money on load or anything that that you need to add to on your data. And also Skype as a very useful tool, especially for OFWs, because this is something that they've been using for a very long time. So the familiarity of the platform makes it even more accessible. So the crisis line is really designed for people who are in a crisis situation and need someone to maybe debrief on or to process just a little bit on their concerns or on their feelings. So this can be done through the chat function, or even the audio calls and or a video call would be good as well. So this is one service that we offer. The other one is on our center counseling services. This is a bit more of the formal appointment basis counseling services. So we do pro bono counseling, we do counseling on a donation basis, and also the individual marriage and family counseling. No? So this is a very good way to also understand the person and understand the concerns of the OFWs, especially if it goes beyond the issues that were brought about by the pandemic, which I will discuss in a little while. Also, we were entailed by the OWA, by the Overseas Workers Welfare Administration during the height of the lockdown to administer counseling services to OFWs who were recently repatriated and are in quarantine. Now, once they arrived from the airport, they are sent to hotels all over the Philippines, all over Manila. We were one of the teams who went to a few of these hotels to visit them and to process their feelings, process their emotions about everything. Now, the repatriation, the the pandemic, and the changes that had accompanied everything. So this is one side of it. The other side of it is we had conducted mental health seminars for OFWs around the world. This is in partnership with the different Polo OWA centers all over the world. We had a few sessions with Polo OWA WDC in addressing the needs of the cruise line workers who were stranded for about 3 to 6 months, waiting for them to get back in the Philippines now, because Middle East OFWs from the Middle East were sort of prioritized and they were sort of put on the back seat. So we helped the Filipino communities there to cope and to address the needs of the Filipinos who were stranded. Some of the other places that we had conducted mental health seminars are in Tokyo and South Korea, which has a high density also of Filipino workers. We mainly addressed emotional concerns there because of the distance and the loneliness that they felt away from their family. And I'll talk more about that in a little while. And also in OWA, Madrid, and London, emotional wellness was also something that we had to talk about. And processing these emotions in small groups really helped them release, ventilate these emotions, and understand where it's all coming from, and help them strategize how to address these emotions. Okay. Um, Throughout all of this, we have been also conducting seminars for the children of OFWs within another program called the Anak Panatag program. This is for children of OFWs to help them process their experience of being a child of an OFW and how that is having a parent as an OFW. So, some other independent involvements with OFW groups across the world. We got the pleasure of knowing an advocacy group called OFW, ang mga makabagong bayani, which made up of OFW workers in the USA. And they formed sort of an advocacy group for OFWs, and we were happy to join them in conducting modules for them, and also for Gulf Livestock One, which is one of the uh, one of the vessels who had sunk last year. So we were able to help them in processing their grief, no, because of the loss of the OFW, the seafarer. So the families that were left behind, we were able to help them out in a group processing and maybe even a family counseling session. Okay. So let's get to the mental health concerns of the OFWs from the pandemic. So based from all of these services that we had provided, these were some of the themes that we had noticed that were very much prominent during the pandemic. And these really surfaced because of the pandemic. So anxiety from the COVID-19 virus was very much high, especially at the beginning, because not a lot of data and information was available to everyone. And that really caused a lot of anxiety and uncertainty for everyone, not just in the Philippines, but also all around the world. The second is having insecure feelings due to job loss, in the sense that they were not able to provide for the family, and there's that insecurity in a sense that their jobs might not be there when they come back, or there's no they have lost their job. So these feelings are very, very much tied into the family values that we will discuss in a little while, and also sadness and homesickness, which is very much prominent also to those who were not able to come home. Okay, so let's go to this one by one. So the anxiety from the COVID-19 virus, especially during March, April, up until around June, when a lot of things were very much uncertain and the Philippines was in hard lockdown, there was really that fear that maybe I got the virus already. And we also felt that with the OFWs because especially with the areas where the transmission was quite fast during that time, they would come to us and address that I'm afraid of getting the COVID virus and what can I do? So these are some of the questions that they were asking us, and that uncertainty really brings about that sense of anxiety and that worrying that can be somehow debilitating in a sense that you can become dysfunctional. You don't go outside anymore. You stop all of the functional work that you do, and that can be harmful to the mental health status of the person as well. So these things all made a great change to the environment and to the routine of the person, and that really causes a lot of uncertainty feelings and anxiety in this person. So another thing that we have noticed is that there are insecure feelings due to job loss. So the primary reason for being an OFW, to be a migrant, to sacrifice our time and our love and our relationship from our families is to be the provider. That's why they make the sacrifice to be the migrant. No, they want that financial stability for their families, and with that comes the role of being the breadwinner. And with job loss and jobs closing down, borders closing, industries closing, everything, OFWs have suffered greatly from job loss. So these have all affected a lot of industries actually. The cruise line workers, the hospitality and service industry, especially, they were very much affected by it and they were very much anxious because of this. And these really caused feelings of uncertainty, feelings of anxiety in their part, and also guilt that they were not able to provide, looking for ways to provide, send money, send remittances back home so that they can provide for their families who are in lockdown here in the Philippines. So all of these things can come and can really shake down a person. But then a lot of our Filipino OFWs actually really manage to strategize and think of ways, how can I still be the breadwinner? How can I still provide for my family? And that really is a show of resilience in the Filipinos. But there's also that sense of uncertainty still. No, I think now there's recovery already. There's a bit of that as well. The repatriation certainly helps, and also in reintegration. We hope that this will really fuel the fire within the OFW, and to really work and to provide for their family as they are motivated to do so, and as they also have that role in them. Okay. And finally, one of the biggest things really is sadness and homesickness. Because of the closed borders, they're unable to fly back to the Philippines now. This is something that has been a very traditional family homecoming thing. The culture really is to have like a big homecoming when you come home, right? And you get to spend time with your family. But then because of the COVID-19 pandemic, the borders prevented this. And a lot of people were unable to really come home. And sometimes this is the thing that like an OFW looks forward to, as they go to another place to work. What they really aim towards is to come back home to their families, after working for a certain amount of time. And with that taken away from them, it really harnesses that feelings of sadness, that their motivation somehow dwindles down and the feelings creep up. Okay. As these, I think, apply more to the countries, to the OFWs where their countries where they work are somehow closer to the Philippines, no? Like Taiwan, Japan, Korea, Singapore, Hong Kong. It's so near yet so far. It's just a 2-hour flight. But then with everything locked down, we cannot. There's no way to do it. Um, it's certainly something that they have been having difficulties with as well. There's also this weighing, no, weighing of options if there is a chance to go back. So there are countries who are opening up their borders already and allowing people to leave and come back. No? The Philippines, I think, are doing the same. No, so they have to weigh their options if, especially if they have to go back to where they work, right? The quarantine time that they have to spend versus the time spent with their family, especially if they only have 2 weeks to take a break. No, do I spend this time on quarantine and spend like 1 day with my family and then go back to quarantine before I go back to where I work? So this is something that they also have to weigh. The financial costs of it as well. With the added health protocols, you pay for your own hotel sometimes when you go on quarantine. These are things that you have to also consider. So with that sort of alleviates and adds to the worrying, to the planning, to the strategizing of this. With this accompanies that sadness that maybe this is not the option for me, and maybe I'll just have to suck it up and miss my family and just be contented with FaceTime or video calls with my family. There's also the problems and concerns back home. So as I mentioned earlier, the Filipino unit is a very close family unit. So everything that happens within the family greatly affects an individual systemically. A lot of these changes brought about by the pandemic also affects people, all the members of the system. So, like for example, the children who are studying in an online school environment, we have been hearing a lot of concerns and struggles by these students, no, trying to adapt to this online school environment, and they're having a hard time because it's so different from what they're used to, or it's so different because there's no space at home, it's not a conducive environment to study, there's distractions everywhere, and maybe sometimes the parents are not even as supportive. So all of these things can go back to the parent who is an OFW, and that brings that anxiety also. They think about that as well, and they want that welfare. They want their child to have a good life and good outcomes in the future, right? And if these things are hindering are hindering his good outcomes, no, these are also things that they have to themselves about as parents. So the systemic and relational problems also affect the OFW as well. They can't help but wonder, no, they can't help but think as well and worry for their family. So with all of these, it really comes out to sadness and homesickness. The feelings are very much heightened, and also there's that feeling of being alone and feeling unsupported due to the distance. No? There's only so much also that video calls can do, but some make do of it, some have a harder time to accept it. So it's a case-to-case basis as well. But then these feelings are all valid. These are all things that have happened during this time. So with that, how do we deal with these? It's hard to see them, but the first thing really is to have that awareness in ourselves that this is actually happening within us. If there's that denial, or if there is no consciousness within ourselves to also see, no, where am I? What am I feeling now? No, that can have that difficulty also in acknowledging it and addressing it for the future. No, once we have acknowledged it, we accept it for what it is. No, we can see also what are my coping mechanisms. Are there things or strengths within me that I can use to help myself? We can also ask support from various resources, such as the community, religious groups, colleagues and friends and families. No? That really helps in gaining support and strength within ourselves and capacities to face the challenges and our feelings and our concerns as well. So if there are further needs, no, psychological services can also be of great help, and we hope that the Ugat Foundation can still be a part of that, no, especially when it escalates. No, we hope to be that we can be that person, or we can be that organization to help you out as well. So with that, ends my presentation. Thank you very much, everybody, for listening, and I hope that we can all be safe during this time. Thank you very much.
Hello, Kat. Thank you very
Hi.
much for that presentation. You know, the comment that you have about some of our OFWs having this sense that they're so near and yet quite far from their families. I also remember the situation of our cruise ship workers who were quarantining actually in
Yes.
Manila Bay. No? Nandito na sila eh. They're already here and yet they can still they're still quite isolated from their families while they complete the quarantine process. So I think later on, maybe in the open forum, we can go back to some of the points that you have raised and also maybe revisit some questions that were sent to us by our registered participants. But it is indeed quite promising that during this time of the pandemic, in a sense, if we're looking for some of the silver linings, technology somehow has enabled much needed services, particularly for mental health concerns. Technology has enabled us to, at least to some extent, be able to make a connection with OFWs. No? And I guess, I don't know, maybe just one very quick question. If you have a sense that somehow our OFWs based abroad, my guess is that they would really still prefer to speak with a Filipino, even if
Yes.
those services are available where they are. Is that
Yes.
what you're getting at?
That's very true, ma'am. Actually, I have received feedback from OFWs, and they have said that it's very comforting to have someone understand the feelings
Mhm.
that they're feeling in their native language, especially
Mhm.
with the dialects actually. So if you're
Yes.
Bisaya, if you talk to someone who's coming from a Visayan dialect as well, it really gives them a lot of comfort and a lot
Mm.
of parang that feeling of relation.
Mhm.
It's
Mhm.
very easy to relate, and it's very natural as well. So yes, ma'am, very true.
Thank you. And perhaps also our OFWs from outside of Metro Manila have also reached out to you, right?
Yes, yes
Okay.
po.
Yeah. Because in the normal circumstances before, like Ugat is mostly based
Yeah.
here in Manila and maybe to
Yes,
some extent with some services in Luzon, but not really throughout the country.
that's right.
So,
I really have seen the depths and the direction of the online setting and how far it took us.
mm-hmm.
So, like with referrals, we have gotten referrals from. I initially did not know that there was this place, but there was this place called Diego Garcia, and we were referred. There's quite a few Filipino
In
migrant
the
workers there
Pacific,
as well. Yes, in the
in the
Pacific.
Pacific.
So we have gotten a lot of referrals from different places all over the world, and they they really see that thank you, they really say that thank you, ma'am, thank you for being here, thank you for
Mm-hmm.
just listening to me, and I feel better already, even if my problem isn't solved yet. I
Mm-hmm.
feel better that someone who's speaking the same language as I am understands where I'm coming from. So that itself is such a big thing already for us as well.
Okay. Thank you, Kat. So perhaps we'll go back to you again later during the open forum. Maraming salamat. We go now actually to the third presentation, and it's about the reintegration of OFWs who have returned to the Philippines. So this is the biggest repatriation that we have so far. OWA data as of July 27, 2021. According to OWA data, 630,854 OFWs have returned to their home regions. So we have so many questions about what happens to those OFWs who are already back home. No? As you can see in the previous presentation by Kat, one of the major anxieties of our OFWs is, about job loss and their sense of insecurity on about the future because they have lost their jobs. So, for those who have been repatriated to the Philippines, how did they integrate in the local labor market and economy? How did the pandemic affect the migration plans and life prospects of OFWs? And what helped them in their economic reintegration process? So, some of these questions may be covered by the presentation of Dr. Jeremiah Opiniano. He is assistant professor in the Department of Communication and Media Studies at the University of Santo Tomas. He recently obtained his PhD in geography from the University of Adelaide in Australia. And for his dissertation, Jeremiah did a mixed method study on overseas remittances and rural hometown investing into Philippine municipalities. The topic of migration and development is one that he has been working on for a very long time. He's also very much involved in transforming research-based information into more accessible language. He's also a reporter and co-founder of the Overseas Filipino Workers Journalism Consortium, a nonprofit news group covering overseas Filipinos. So, Jeremiah, over to you.
Hello, let me share
Unmute.
first my screen. Hello. Hello.
Yes, we can hear you well.
Can you see my screen?
Not yet.
Because I think I froze.
Okay. But we have a copy also.
Yeah.
I mean,
Anyway.
does Max have a copy?
Yeah.
Okay.
Anyway. Can I ask Dax to uh, share the screen because I froze already. Oh, it's here. Sorry, it's here. Just a moment. Okay. Can you now see my screen, ladies and gentlemen?
Yes.
Okay. Can you now see this full screen?
Yeah.
Okay. Thank you. I'll begin. Konnichiwa. Good afternoon to all of you, friends, and welcome to the Delta phase of our running COVID-19 pandemic. This is the current reality of how this invisible enemy continues to interrupt our lives and our futures. But this reality that we call SARS-CoV-2 can be conquered. We all anticipate the end of this public health madness. The earlier, the better. Note, however, that when the world settles down and tries to regain its bearings, the path to recovery remains rocky. Remember the 2008 2009 global economic crisis? Recovery began happening 2 years after. The first half of this new decade is all but filled with a path through suffering. Not that I'm sounding religious, yet look at the eightfold path of the Buddhists for people to end suffering. The 8 steps to end suffering, the Buddhists say, are for people to have the following: the right understanding, the right intention, the right speech, the right action, the right livelihood, the right effort, the right mindfulness, and the right concentration. These steps may give us lessons on how to sail along from this pandemic and as we approach to what is called the new normal. The key word for today's sharing is paths. Overseas migration is an alluring pathway to economic success and for people's dreams to come true. For decades, overseas mobility has been a major passageway for Philippine economic growth. Last decade, the Philippines was enjoying consecutive years of high economic growth. Overseas Filipinos and their remitted money visibly made that positive economic story happen. No matter the visible family unity challenges that migration brings, the overseas Filipino family has endured, and this Philippine homeland has been trying its best efforts to address all these vulnerabilities facing as many geographically dispersed Filipinos. That was until a novel coronavirus stopped the world on its tracks, changing our lives and Filipinos' futures beside migration forever. Unfortunately, migrants and foreigners got infected. and some have journeyed to eternal life. Migrant workers were retrenched from work. Others who stayed on saw their incomes diminish and their working hours reduced. Not surprisingly, and as presented earlier, migrants' mental well-being teetered. Other origin countries of migrants grappled and got rattled with what to do given the displacements of their compatriots in host countries. But the Philippines banked on its decades-long migration management system to help affected Filipino migrant workers. So imagine if the Philippines didn't have this migration response system. The pandemic has led to the Philippines' largest migrant worker repatriation response effort. From the first pandemic-induced repatriation coming from Wuhan, China, until last July 11, over 612,000 migrant workers have been repatriated. If we include those migrant workers who return home but are not part of repatriation flights, 1,050,232 overseas Filipino workers have returned. And then, if we include returning overseas Filipinos who are not migrant workers, the grand total of overseas Filipinos who have returned is 1,311,057. Nevertheless, migrant worker repatriation has been the most dramatic phase of the Filipino migrant story beside the pandemic. What automatically followed this biggest repatriation effort is perhaps the most extensive government response to the reintegration of returning overseas workers. Prior to the pandemic, the usual suspects, migration government agencies such as the OWA and the National Reintegration Center for OFWs, were involved in reintegration. But because of the droves of migrant worker returnees, an entire bureaucracy, for the first time, instigated a whole of society approach for migrant reintegration. Which now brings us to the core of the sharing, the paths that returnees trekked in their return home. A bold survey from the International Organization for Migration tried to determine information from 8,332 returnee overseas workers who were assisted by the Philippine government. The results of their non-random survey can give us ideas of the paths the returning migrant workers took or planned to take. 3 months upon arrival, 83% of surveyed returnees were unemployed. Most of these unemployed returnees are within 25 to 39 years old, so at the prime of their working years. If these unemployed returnees want to work here, they prefer to be in the services sector. Prior to the pandemic, overseas workers surveyed earned between 20 to 50,000 pesos, with females earning more than males in this income range. Just above half of migrant workers surveyed remitted 10 to 20,000 pesos monthly. Most females remitted less than 15,000, while most males remitted more than 15,000. So it reveals their occupations overseas. But when they returned home, nearly half of returnee migrant workers claimed to experience a 60% drop on their household incomes. About 17% of migrant workers did not receive their final salary, as another 59% claimed they did not receive their separation or compensation pay. Surveyed returnees claimed most of the repatriation support they got from their employers, followed by the Philippine government and by fellow migrant workers. That is even if the Philippine government bankrolls repatriation flights, quarantine stays, and return to their origin communities. On the contrary, however, 7 in 10 returnee migrant workers did not get any legal, health, and logistical pre-departure support from their employers in host countries. Now let us see the paths the surveyed returnees took or that they want to take. Nearly half of returnees, 48%, want to return overseas. Of that number, 6 out of 10 of them want to return to the same destination country. More males want to remigrate over females, driven perhaps by the fact that many returnees were seafarers who have renewable 9-month contracts. Interestingly, 46% of returnees did not register or did not access available government programs and interventions that will assist them in their reintegration. Meanwhile, 26% received reintegration assistance, with males filing and receiving more assistance than females. Unsurprisingly, three-fourths of surveyed respondents want to receive assistance in cash. Note here that returnees were given 10,000 pesos or $200 from the Overseas Workers Welfare Administration if they were truly fired from work, were made to work less hours, or if their incomes were slashed. That is why nearly 8 of 10 respondents think finding an income source while they are at home is the most challenging concern beside the pandemic. On what to do while reintegrating, 45% want to engage in livelihood-related activities such as running a business. Females preferred livelihood activities more than males. Meanwhile, about 27% of returnees prefer to be employed. Seafarers prefer private employment than land-based returnee migrants. As for the 45% who want to venture into business, 7 in 10 of them do not have startup capital to jumpstart businesses. We can assume that perhaps the 7 out of 10 returnees who want to venture into business may not have as much savings during their return journey. Why these conjectures? Among those who did not have capital, half of them do not know how to finance the business. There is also a preference for business ventures related to sales and services, as well as to food. These two preferred ventures have become necessary during this pandemic, well, especially during the lockdowns and for this forthcoming lockdown. But going into business is not the only way that can help returning migrant workers. Skills training also helps improve returnee skills. Half of survey respondents expressed interest on improving their skills, especially through the online training programs of the Technical Education and Skills Development Authority, or TESDA. It may be possible that newly acquired skills may lead to entrepreneurial ventures. The IOM survey has helped us solve a big portion of our question. So what paths do they take? But under what context do these trends operate? Note that international migration is an instant provider of exponential incomes for Filipino workers and their families. As the migrant prolongs working or staying overseas, the bite of higher incomes continues to sting. The family desire to improve their lot had been achieved with migration. And to apply a principle in behavioral economics, the new economic standing gained by the migrant family becomes their new reference point or baseline. So anything below that reference point becomes their pain. No wonder that last year, Filipinos abroad tried to muster all that they have to send money in whatever ways or means possible. How can you explain that 2020 cash remittances from Filipinos abroad is only 8% less than 2019 totals, minus 0.8%? When many host countries saw businesses close shop, when many jobs disintegrated, and economic growth became lower and slower. But it begs to ask, when incomes truly diminished because of the pandemic, did the migrant family tighten their belts? Look at this multiple year result from the survey on overseas Filipinos by the Philippine Statistics Authority. A year prior to the pandemic, overseas workers who saved from their cash remittances reached their lowest over a 10-year period, 32.8%. In that same 10-year period, even the small savers, that is migrant workers who allot less than 25% of their remittances as savings, also reached their lowest. So you wonder, what happened to family finances when the pandemic came? The quarterly Consumer Expectations Survey of the Philippines Central Bank can give us cues. I did not include here daily expenses and education because these expenses did not waver during the pandemic. So we will just focus on 4 specific items: medical expenses, debt repayments, savings, and investments. From the fourth quarter of 2019, medical expenses spiked until they returned to pre-pandemic levels just this second quarter. Investments steadily rose, but not as exponential as we would have wished. But look at debt repayments. Since the first quarter of 2020, debt repayments breached below 20% and reached 15.9%, the lowest since the second conduct of the BSP's survey. Savings plunged sharply from 44.7% during the first quarter of 2020 to 31.6% the following quarter. That 31.6% figure is the lowest since the second quarter of 2008, during the period of the global economic crisis. So we can infer that prior to and during the pandemic, savings from overseas remittances were getting lower. While many of IOM's respondents did not answer the remittance-related questions, you can tell that there is congruence between how returnees perceive themselves financially and how these national surveys reveal the limited savings habits of many overseas workers and their families. This pandemic may have given them and all of us hard realizations. So you then wonder, if they return, what paths do they really take? Answering that question banks on how prepared they are for the return. Though the explosion of SARS-CoV-2 did not prepare many of us or many migrant workers at first. I borrow here a 2016 survey research done by a development studies professional, Jemery Bernas, from the Institute for Labor Studies under the Department of Labor and Employment. Bernas, who is now based in Japan, said there are 5 types of returnees. We have returnees who are struggling to be reintegrated. M1, these returnees had low levels of preparation to return. Their contracts were abruptly terminated, unfinished, or breached. As some of them may have experienced work-related abuses. Returnees here may take various paths, but they are unsure which path to take. We have those returnees who disengaged to be reintegrated, or M2. Their contracts have finished and were conscious of when and how will they return home. They have some level of preparedness to return, though they may be willing to stay home and not return overseas. M2 returnees may be socially and economically stuck, to quote Bernas, to the situations they faced before they first went overseas. We also have returnees who are undecided to be reintegrated, or M3. The work contracts of these returnees have finished, and they are aware that it's time for them to come home. They also have some level of preparation to return, but it is to them that they will stay in the Philippines temporarily. They want to be redeployed abroad. Their economic reintegration may be temporary too. We then have returnees engaged to be reintegrated, or what Bernas calls as M4. They are highly prepared to return. They intend to stay home for good. They want to reestablish their social ties with family, relatives, and fellow community members. They may also be coming home in a good psychosocial state, thus rendering them able to engage in economic activities back home. There is a 5th type of returnees, the irregular or undocumented migrants, or M5. And these returnees need all the help they can get, including mental health and psychosocial services, or MHPSS. These typologies by Bernas are not cast in stone. Applying these to today's pandemic returnees may need a reanalysis of IOM survey data. But on hindsight, we have an idea who came home, how prepared they may be financially, physically, and emotionally, and what interventions fit them. Given this pandemic, migrants or not, we all seek sanity, safety, safety nets, and shelter. And for affected overseas workers and their families back home, back to where they were born, back to where their families live, that is their shelter. Reintegration is largely rooted from geography. At the macro level, the economic growth of a country shapes how many overseas migrants will approach their reintegration. But the real battle happens in local communities, their hometowns. While they are abroad, these overseas Filipinos keep themselves abreast of what is happening back home. Well, that's logical. Whatever their birthplace communities offer determines how their integration occurs. It's like money. Money goes to wherever the resource can be made best efficient. The owners of the money think the same too. This means that the birthplace communities of our compatriots abroad must try to improve their lot, not just for themselves and immediate residents. Communities strive for development under the watchful eyes of townmates, whose remittances help spur local consumption, some businesses, some housing construction, some farming, some localized forms of saving, and some community building through volunteerism and philanthropic giving. It means if migrants' hometowns are nice places to do business in, are accessible to target markets and financial services, are governed well, and whose public services are delivered efficiently and effectively, anybody will be attracted to risk their disposable incomes and see how their money grows over there. Which leads me to saying another point. As a proverb goes, different strokes for different folks. Different Philippine communities have unique geographies and topographies, local cultures and norms, economic activities and styles of leadership and local community building. Individual residents of a place respond differently to what prevails and happens locally. Reintegration by returning overseas migrants, therefore, is not a one-size-fits-all thing. Let me cite an example from a recent doctoral project. There were two rural municipalities studied, San Nicolas in Ilocos Norte, which is sandwiched between two cities, and Moncada in Tarlac, which is some 30 kilometers north of the provincial capital of Tarlac City. Both of their local governments are efficiently governed, as attested by their Seal of Good Local Governance awards. Both municipalities' local leaders have laid down speedy processes to acquire and renew business, building, and occupancy permits. Both towns have even received awards and commendations for various areas of development: agriculture, child protection, business friendliness, local heritage, drug prevention, and many, many more. Even social services such as health, education, and social services or social welfare operate efficiently. But what differed? This differed. There were more overseas migrant families from San Nicolas compared to those counterparts from Moncada who saved with hometown-based financial institutions, who invested locally, and who opened and ran businesses over there. San Nicolas only has some 36 plus thousand residents and is a second income class town, but it's strategically located in Ilocos Norte, favoring travelers, tourists, and even entrepreneurs and investors. Yes, San Nicolas is a farming town, but within its premises is Robinson's Ilocos, the only mall in the province. Thanks to that mall, local businesses were created. Car companies, financial institutions, and supermarket chains opened branches in San Nicolas. Even if the town is landlocked and there's no natural body of water, San Nicolas constructed 14 small water impounding projects to irrigate rice fields and increase farming productivity. The joke is that San Nicoleños in the US made is this: San Nicolas is the Makati of the North. The 500-kilometer MacArthur National Highway begins its first full stretch in San Nicolas, and the town is enjoying the economic fruits of a strategic location. Moncada, for its part, is bigger in terms of land area and is classified as a first-class income town. It is an agricultural powerhouse with rice, corn, kamote or sweet potato, and onions as the leading crops. A village there received a lot of ashfall from the 1919 Mount Pinatubo eruption. But years after, the lahar made the soil more fertile in that village, thus spurring the production of high-value crops such as sweet potato and onion. Moncada may not have a commercial bank within its premises, but the town is regarded as the cooperatives capital of the province, given years of cooperativism and the presence of the two largest cooperatives of the province. But Moncada is constrained by the limited commercial spaces available and by the flooding in its southern part, given a basin-like topography. Beside Moncada is a fellow first-class income town, Paniki. The financial institutions, businesses, food establishments, and population size all work to Paniki's favor. Paniki even has a bigger population area or the center of the town where there's much room to open businesses. So logically, if you're a Moncadenian investor, where best to invest? If Moncada is a national awardee for rice and corn production, would hometown agricultural investing appeal to the overseas Moncadenian? The local leaders of San Nicolas and Moncada have steered their local governments to render better public service in consideration of local needs and of the geographies of their places. Both towns showcased their economic competitiveness. But then again, their outcomes differed. San Nicolas had more registered businesses, local tax revenues, and local jobs created than Moncada. Yet surprisingly, not even the presence of over 20 bank and non-bank financial institutions in the two towns can encourage more local residents to save. Then again, investors and entrepreneurs may be looking for signals, such as the availability of commercial spaces. Enterprises in San Nicolas are spread across many of its 24 barangays, not just in Robinson's Ilocos or in the public market. Moncada, for its part, has scattered agricultural enterprises in its 37 villages, but non-farming ventures are largely concentrated in the area, where the already filled public market is. Thus saying, different communities provide different pathways to the different types of returning migrant workers who were directly and indirectly affected by the pandemic. We have lots of untold stories from those over 1.3 million overseas Filipinos who returned and who got repatriated. Their stories may have to be captured and told to a global Filipino audience because their lessons provide specific policy measures for local governments. There may also be another relevant pathway to look out for: the availability of mental health and psychosocial services for the broader Filipino population. Since there is much disparity on what MHPSS services are available in various communities, we can only hope that civil servants under the health and social welfare offices of local governments remain physically strong to render MHPSS services. The paths of those who come home because of the pandemic go different directions. This observation comes not only because of the varied makeup of Philippine communities, or because of the types of returnees that we have. The human mind is at work. As the 2015 World Development Report by the World Bank writes, people's decision-making may be easily influenced by the events that people notice, by networks and norms in communities, and by how people understand the world and what works. Decision-making, in this case, reintegration by returnee overseas migrants, can be a product of an interaction between mind and context. What comes as desirable and as possible for individuals may be actually prompted by psychological and social influences, as the World Bank wrote. What this means is that determining the best paths for those who come home warrants the availability of needed psychosocial and economic services, of responsive migration-related interventions, and of having a conducive local environment. All these will help the migrant's human mind to think and decide conducively, critically, and carefully how best to make the wisest decisions beside overseas remittances while overlooking the world's modern-day plague. This pandemic put our country and returning migrant workers' emotional states to the test. If we want to end suffering as how Buddhism tells us to do, we have to fight on. Thank you very much.
Jeremiah. So that was very, very comprehensive. I think Rick has some quick comments to make before we also jump into the discussion part of our webinar today.
Yes. Thank you, Jeremiah. Thank you, Marla. Certainly, this study and account of Jeremiah on the different pathways that OFW come into when it comes to reintegration is very, very relevant, no? And it puts to like an update, no? What has really government done, no? With several interventions that were done before the pandemic, no? There were years of projects in IOM, ILO, and elsewhere, no, and down the ground related to reintegration since about 2008, if I remember, no. And now is a reckoning point. No, it is the time to see where the learnings in those projects have come. No, and I am glad to see that in the OWA they have adopted the framework that has been born out of the very intense deliberation we have had in one of our workshops, not to really define what are the options of the returnee, who they are, no? And I remember that table that Jeremiah shared as a recent from an intervention of Dr. Joel Villanueva, Dr. Joel here, no? When we had a workshop, no? And indeed, we can see the critical difference between a well-planned returnee and a forced returnee, forced um, by crisis, no? And what I don't see has been happening is because during the time we had all this surveying and study, we have been hearing that migrants, OFWs wanted to succeed in family reintegration, no? Or just retirement, or be in community service, or be uh, absorbed by government, no, in the public service, no. All we see here is the desire to see an alternative livelihood back home, no, employment and entrepreneurship, no, very very clearly, no, and with that, really now that this is happening, I remember the World Bank also mentioned that migration has to be managed much more on return migration nowadays, no, and it's evidence that we have had a big return migration happening since 2020, no? And what does challenges government is to emphasize the opportunity lens in governance, no? Where will you bring them, no? Beyond this dole out or beyond the traditional training intervention, skills training, where will this all end up to, no? Where will they apply all those skills? Where will they use those little money given them, no? What sustainable income generating activity will they be drawn into, no? And so if we fail in that opportunity lens in migration governance when it comes to return, the returnees, and remember that they're forced returnees, they have hardly really saved anything. They were caught on alarm, and that's why it throws me to the question: what happened to the financial literacy training that has been happening since 2008? No, it seems that that is something not very well achieved in the whole scheme of things. No. So hopefully, nowadays that we have pandemic, we all see problems and we all see how to facilitate handling of all this repatriation in the most careful way. But I hope that we are not missing out on opportunity lens, no? And I guess at this point, we will need to proceed with our discussion, Marla, with our next resource speaker. If you may allow me to proceed, Marla, to introduce him. We will hear from Mr. Wilfredo Priles Jr. No? He is the Dynamic City Planning and Development Coordinator of Naga City. No? He steered the city's 10-year comprehensive development plan, 2011 to 2020. Naga's CDP is the first to successfully mainstream migration and development issues in the Philippines. No? I remember Naga has had won and earned recognition for this among other awards that the city has earned. And IOM was very proud to have been also one of the first to come into the city and help them in this endeavor. No? Mr. Priles holds 2 master's degrees, no? And one in Master in Philippine in Planning, Growth, and Regeneration from the University of Cambridge in the UK, and a Master's in Management from Bicol University Graduate School. So, ladies and gentlemen, let's hear from the very hardworking Mr. Willie Priles.
Thank you very much, Rick. Magandang hapon po sa inyong lahat. Magandang hapon po dun sa tatlo nating presenters. I'm happy to have been given the opportunity to share my reaction to the presentations shared by them in regard to the topic. Let me start by saying that Naga City, just like the other localities in the Philippines, is also reeling from the effect of this unintended or unplanned reintegration of our fellow Filipinos who have been working abroad. To put context to the challenge we're facing, meron po kaming Migrants Resource Center that was established because of the technical assistance that Rick mentioned, yung effort to integrate our migration and development issues in the local parent process. Ang pinaka konkretong resulta ng tulong na yon is the presence of this MRC. Ano yung naging papel ng MRC namin dito sa usapin ng reintegration? Albeit hopefully temporary lang para dun sa kalahati na sabi nung survey ni Professor Jeremiah, are still planning to go back in the abroad to pursue the greener pastures. Yung kuwan po namin, yung Migrants Resource Center namin actually facilitated the assistance extended by the national government to the sector. Dito sa listahan na hawak-hawak ko, the national government actually financed more than 44 million or set aside more than 44 million for more than 2,500 returning overseas Filipinos caught by the pandemic and forced to return to the country dahil nawalan ng opportunity to continue with their work there. Kasama dito sa perang ito yung ginastos nila para sa quarantine, RT-PCR, test, bus rental, at yung tulong, yung parang starter kit to start a business, to tie them over for the period. That is substantially higher than what the government has allocated. For instance, dito sa Naga, yung business stimulus fund namin for the local citizens who are in employment, dalawang klase. Meron kami community employment, yung naapektahan na nangangailangan ng trabaho. So merong dinivise na program to provide them short-term employment in the interim. At merong business stimulus, yung gustong magnegosyo, pinapahiram ng interest-free loan ng city government depending on the amount that they can handle and what their business plan requires. Meron ding maliit na pera na set aside for the sector, pero that really pales in comparison with what the national government has allocated. So ang mensahe dito is that kahit papaano yung national government has been able to help to provide a minimum assistance that we can give to the returning overseas Filipinos. So 2,500 or so is a significant number. Easily makakuha niyan. Mga 20% yan ng mga bumalik dito sa Naga. So sila yung kailangang tulungan ng city government when the lockdown happened and when the lockdown was eased and allowed them to return to the city. Pero ilagay ko sa konteksto yung challenge na hinaharap namin at the same time. We were just in a focus group discussion with the business sector dito sa Naga. Ateneo de Manila and Ateneo de Naga actually is doing a study trying to quantify the impact of the three hazards or disasters that face the city. I don't know if you realize that aside from COVID, last November and December, binisita kami ng Bagyo. So that has become a regular occurrence. And since March of last year hanggang sa ngayon, hindi pa kami nakakabangon doon sa African swine flu. So tatlong hazard yun. And idagdag mo na yung COVID. Parang tiningnan ng mga participants kung ano yung may pinakamalaki ang tama. Hands down, COVID yung pinakamabigat. Yung Bagyo, ang sabi ng participants, give it 2 weeks, nakakabangon uli yung syudad. But this pandemic is something else. Ang sabi ng mga negosyante, And to some extent, merong mga negosyante na merong mga investor na overseas Filipinos. Nung 2020 anya, we're a little bit better kasi we still have the savings from our operations to count on. Pero this 2021 is something else. Wala na kami nung masyadong savings. So the city government should plan for 2022 na mas maraming businesses ang pwedeng magsara. So we've taken that in mind, especially considering na 2022 is the time na yung mga local governments are actually being required to plan for more extensive devolution. I don't know if many of you realize that there is the Mandanas law that actually gave local government units access to more resources dun sa national transfer tax, yung dating internal revenue tax. So 2022 will have more money. Unfortunately, starting 2023 and 2024, taghirap na naman. Kasi yung pera galing sa national government that is computed sa revenue na nakuha or nalikom ng national government 3 years back. Yung 2023 will start with the time na pumasok yung pandemic. That's 2020. And 2024 will be 2021 ang tax base niya. So parang may isang palugit lang within which we can enjoy the benefit of this new law, new policy, because it's the result of a case filed in the Supreme Court. So ano yung prognosis o ano yung paningin ng mga negosyante namin? Things are not, ang sabi nga niyan, things will become worse before they become better. And I think that assessment also applies to the returnees. Right now, the country is starting to feel the brunt of the Delta variant. Naga City actually just overcame a surge that started in March. Lahat ng significant amount of our spending is going to the maintenance of quarantine facilities, the extension of aid to those families who are locked down. So hindi talaga kami nakakapag-focus ng attention namin to definitive growth-oriented spending. Easily bumaba yung revenue ng city. Yung budget namin was 1.5, ang nakolekta namin was only around 1.2 billion. And at the same time, we're being required to spend easily another 10 to 20% of our budget to cope with the pandemic. So on that respect, we're working with the DOH, trying to contain the virus. Right now, mayroon kaming application with IATF na bumili ng sarili naming bakuna kasi sa tingin namin kulang yung bumababa galing sa national government. Unfortunately, hindi pa kami nabibigyan ng permit na bilhin yung pinaplano naming bilhin para at least makaabante kami doon sa target na herd immunity. So ano yung mensahe doon? Yung mensahe doon is that on the one hand, merong local governments trying to make ends meet, do more with less, invest on a solution that will allow us to at least pick the pieces na dala nitong pandemic na to. But sometimes yung national government is not cooperating. And in that respect, tungkol yan sa vaccine procurement. Without this intervention, mahihirapan yung mga workers natin na magkaroon ng guarantee na may protection sila. Kasi ngayon, nasa A1 to A3 pa lang kami. May mga challenges kami in vaccinating the senior citizens and those with comorbidities. Pero unless we hit 85% of that sector, hindi kami makakamove up sa A4. So meron kang, on the one hand, problema sa availability ng vaccine. On the other, yung ability mo, your ability to work within the policy constraints of the national government. So it's really a challenging thing to face this pandemic. May isang pagtingin na yung mga nasa gobyerno ang medyo stable. To some extent, that's true, pero yung mga challenges na inaharap ng mga local communities actually are making things difficult from where we come from. So, ano ang mensahe natin moving forward? The message there is that we should be able to get our acts together. We are looking at a bleak scenario. First and foremost, dapat yung Delta variant, the optimistic scenario is that should not be able to penetrate our territories. Pero we are preparing for the eventuality na baka pumasok yun. And if that happens, kailangan yung mga local communities should be able to handle the projected increased number of cases that this COVID-19 variant will bring. So again, this is preventing us from really thinking long-term, and that actually is sacrificing the ability of the city government to respond to the needs of the overseas Filipino workers. May pagtingin kasi na yung OFWs are better off, which actually is not the case. Nahihirapan din sila. And kung paano yung mga negosyante namin nakakapagsabi na 2022 will be much worse kasi yung savings namin are actually depleted. I would assume the same is true with the overseas Filipino workers. So, the only thing that will accelerate the solution of this pandemic for us is if we are able to get our acts together, work with the central government para makatulong talaga yung local governments in procuring the vaccine. Kasi kung yung mga bumababa, kulang pa. We understand on the one hand that there is a need for vaccine equity, but on the other hand, kailangan hayaan ng national government, yung mga local governments who have the capability to provide a solution that their own communities require. And this dovetails well with Jeremiah's point. We'd like to believe that we're more of the San Nicolas rather than the Moncada. So sana hayaan kami ng aming mga stakeholders, fellow stakeholders like the national government, the business sector, the OFWs, para mas makatulong kami. Kasi ang mahirap kung yung budget namin maubos lang doon sa ayuda. Kapuput up ng quarantine facilities, yung ayuda sa mga affected families na lockdown because they were hit by the virus, etc., etc. Pwede na sanang i-rechannel yung resources na yun in procuring the vaccines, but right now, nahihirapan kami in securing the permit from the national government. I know that there is a representative from the DOH, so hopefully baka matulungan kami ni Dr. Joel na ipaabot sa leadership ng national government yung panawagan na yon. Kasi that's the only way that we can really move forward. Kung wala yung bakuna at hindi mabakunahan yung majority ng population, this pandemic will still be with us. And the worst fears of the business sector will, I think, come true. Things will continue to get worse before they get better. So siguro I'll end at this point unless you have questions or clarifications that where we see things from the local level. Lahat naman tayo hindi ready to handle this phenomenon, but we're learning and hopefully we should learn to work together. Maraming magandang hapon po sa inyong lahat at stay safe. Yan na lang po ang masasabi ko on the last point. Maraming salamat po.
Maraming salamat, Willie. And actually, your presentation really dovetails to the presentation of Dr. Joel Benaventura. No? But I'd also just like to quickly say that we really truly appreciate what you have shared with us and the enormous challenges that are faced by local governments. No? So I think one takeaway message that I have gotten from your presentation is that really the focus now of a city like Naga is simply to take care of the health aspect and to make sure that the virus doesn't spread to the better part of the population. No? So parang, and I guess even the energies of people, even if Naga is one of the first cities to have the Migration Resource Center, the energies of people that are connected with the MRC are also just so focused on trying to contain the virus and to keep everyone safe and healthy. Tama po ba?
Tama po, ma'am.
Yes.
From a COVID survivor like myself,
Oh.
yes, you hit the nail in the head.
Hmm. We're very glad that you survived. And actually, if you won't mind, I would also mention that Rick is also a COVID survivor. No? So
Yes,
this,
Marla.
it is very
Uh,
real, no, to
yeah,
us. No? So thank you.
it's it's a very real situation, and it just reminded me that in one of the most um, vivid sharing of Vice President Robredo, she said that we need confidence building, no, in order to be able to start start anew, no, and to seek opportunity and to move on, no. And the confidence building, you are right. You are saying it's all about the vaccination, no, the
Mm,
pandemic handling, no. And that's why the challenge that I was raising to Jeremiah a while ago about opportunity seeking, it seems it's hard, no, because
mm,
you said we are still going to face the worst before we can really get back to our toes, no? And we can say that it's very very difficult to have this concern not addressed now because of our own individual experience being COVID survivor. No,
mm,
particularly I had a serious case. No, I had been facing all the situation that could have driven me to mental
mm,
disarray, no? And really a challenge, no? And good enough that I am finding the pathway in order for depression not to set in, no?
mm,
In many ways, no? And
mm.
all these things are connected, no?
Yeah. So I think Rick, maybe we bring in Dr. Joel Benaventura now. Yeah,
Yes.
and also just to also advise our audience, we'd like to ask for your indulgence. Now we will extend the discussion. I hope that you will still continue to stay with us. No, but let me briefly introduce Doc Joel because I think the topic is so hot now, coming right after the presentation of Willie, who presented to us the many challenges, no, that are faced by a city government. So I'd also just like to briefly introduce Doc Joel. He's a very accomplished doctor. He's a real doctor. With also a master's in public health. He's the chief health program officer of the migrant health unit of the Department of Health. He played a very important role in the crafting and approval of the Philippines' national policy on the health of migrants and overseas Filipinos in 2016 and in organizing the Philippine Migrant Health Network. He actually recently completed the training program in global health diplomacy from the Global Health Center of the Graduate Institute of International and Development Studies in Geneva. And soon after that, he already spearheaded the pilot run of the Foreign Service Institute's basic course on global health diplomacy, which was conducted online from July 13 to 16, 2021. Doc Joel, over to you, and especially because Willie also has a specific request. Thank you. Kindly unmute. Dax, are we okay with Doc Joel's presentation? And okay, there it is. And also, Doc Joel, kindly unmute.
Yes, hello, good afternoon.
Okay,
Sorry,
yeah.
can you hear me?
Yeah, you're okay now. Thank you.
All right. Sorry about, I think, my connection. But thank you again for the invitation on this webinar. Um, And thank you for accommodating my request to go last with because I had an emergency meeting. But again, my sincerest thanks to everyone, and hopefully to the participants of this webinar, you'll bear with me. I think a very relevant topic for this afternoon, and I think every one of us will have this story to tell to our grandchildren about how we lived and how we managed to survive in this pandemic. As you all know, COVID-19 is an unprecedented pandemic. No one knew, we know about pandemics based on our experience, but not this level at like the COVID-19 level. Each one of us have our own lived experience in the pandemic. And really, I think COVID has changed a lot of things and is actually continuously changing the way we live. And I think from the presentations that we've heard, I just wanted to actually just you know pull the discussions a bit higher at the macro level, because I think the presentations were very valuable in terms of really um, showing what has happened really in this unprecedented times. But I think my reaction and my discussion would focus more on really trying to understand why is this so. I mean, it's not COVID-19 which basically produced all this. I mean, I feel like personally, I think like the chronic underfunding in health has really exposed a lot of the health issues that are coming out. Like our chronic neglect of mental health, as we see, has been really emphasized and highly discussed during this just recent pandemic. And I think I wanted to pull up like just 4 points as an anchor to my discussion. If you could put on the next slide. I think these are actually very basic points. First is that migration is we have to really think that always put at the back of our mind that migration is a social determinant of health. Um, a lot of things that happen during the migration process, actually, which I think the presentations of the our presenters has really touched a bit on, like the various individual lifestyle factors, social and community influence, the living and working conditions, and the general social, economic, cultural, and environmental problems. The experiences that were relayed to us by the various speakers has really emphasized that you we need to see migration as a social determinant of health. And in that sense, we go to the next point that I'd like to emphasize that migration uh, it affects health outcomes. And I think because as a social determinant, basically, we have to really think about how migration is really affecting the health outcomes. You can imagine, if you could put the next slide on. Uh, yeah, so basically, migration affects health outcomes at various levels, just like what I pointed out in the previous slide. And what I wanted to also highlight is that in terms of the mobility during the COVID-19 pandemic, and the connection of mobility and migration in the spread of infectious diseases, this is something um, that has really that was really highlighted in this pandemic. That is why when we say, I think when Yasmin, Dr. Yasmin was discussing about the pivot in terms, I think we also have to really, on the other hand, I'm thinking that we also have to see it from the lens of public health. because mobility at this time is uh, 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 is very much important to consider because of its effect in the spread of infectious diseases. And we have data to show that basically among those who have returned, about 20,000 plus OFWs, representing about 1.41, about 2% of those who returned actually were positive. And we know that the variants that are spreading right now are actually are not, they are not um, they did not develop locally. They come from actually from migration. They come from mobility, and it's a result of the migration and mobility of people. And so these problems, I think, when you see it basely more from an employment or a labor perspective, when you see it from when you also consider the perspective of public health, I think that is really where you do, what they say, the balance between health and economy. And I think we see that, I would say, dance, as Sir Rick was mentioning a while ago. Like we're trying to really balance health and economy. The third point I wanted to tell you is, it's very important for us to also think that health needs vary across the migration cycle. So the emphasis on the health needs, say for example, of returning migrants versus the health needs of those who are just about to leave, the health needs of those who are in the destination countries are different. And so it's really a challenge for us to provide migrants sensitive health services. And I think it's important, especially, I think, it was mentioned by Katrina, that about the mental health status. So I think we have to consider also, in terms of the migration cycle and where they are. So the mental health needs of people who just returned are different for those who are just about to leave. So I think that's a very important point that we also have to consider. And last slide, I think, and I'll end on this, is that health issues vary across migration typology as well. So I think Sir Jeremiah has mentioned this, the M1 to M5, that was referred to by the IOM. So Philippines, were usually, when we say migrants here, we're really thinking about our OFWs, our international labor migrants, but there are other subsets of migrants. We have internal migrants here in Philippines, those who are displaced, like what Sir Willie was mentioning about, the typhoon. So there are displaced population. There are also migrants too. And how about like the health issues for them? The trafficked persons we see. We also have refugees, asylum seekers here. How about the displaced people in Sabah, the transferees from Sabah, and the foreign nationals who are here? So these are the health issues vary across really migrant typology. And maybe what I just mentioned is that probably, if we really think about the whole complexity of things, I would agree with what Sir Jeremiah mentioned, that there's not a one size fits all thing. And I think most of the things that had happened during this pandemic is more of a policy response, which is anchored on previous policies that were set by the government. So I think the deployment ban, I would say, it's more of a pivot. It's more of a policy response. And I think in terms of of these policies that have really changed and was shaped by the pandemic. And we have to really also consider that policies are made at a certain point in time, and decisions are made at a certain point in time. And we know that the information, especially in during the COVID-19 pandemic has been changing. So we don't know about it. So initially, we didn't know about the variants, and now there are variants. So the decision making and the policy process has really been changed by all this information. And I think sometimes it's really hard to generalize, because like that decision was made during this certain point in time when the WHO does not yet say that, say for example, COVID-19 is airborne. And so, there are so many other policy changes, and I think at the end of the day, I really like what Sir Jeremiah was mentioning, that not one there's no one size fits all. There it has to be nuanced, like our policies have to be nuanced. And in terms of migration, we can always just say that migration is really something that cannot be stopped. It can only be managed. And when we think about, when we know our values, when we know our the things that we're about to trade off between health and economy, then and we made the decision, I think that's a collective decision that we have to make. Thank you.
Thank you very much, Doc Joel. Rick, I wonder if we still have time for further questions. I think we can extend a little bit, no? We have
Yes, yep.
already requested permission also from our participants if they can stay on for a little while so that we can probably discuss some of the things and maybe react also to what Doc Joel has said and
Yes,
give way to some
definitely,
of the questions.
Marla.
Yeah.
We need to be able to have more time to listen to what concerns our participants have. But Dr. Joel, congratulations for your sharing, because that is very striking for me. I really think that health management must be core in governance now. No? And I hope that this also teaches us a lesson that it has to be a core of a public service delivery system and development planning, no? Which is not in the past. No, it's always in the margins. And as you started, budget, no, resources have been prime of health, no, and it's all related. It's in the mainstream, the brain drain issue, the even ethical recruitment must be broadened into is it ethical when a country would irate your nurses at the most difficult time, no? More issues have to be disentangled with many other perspectives, no? So to approach it that way.
But I
Yeah.
think, Sir Rick, you have to balance it, because I think sometimes it's who decides, that matters. Because like we always knew, like that we have always had complaints about, say, ethical recruitment of health workers. So I think Doc Yasmin has mentioned it in her talk. How can you send more health workers when your country is? But I mean, but I think sometimes we know the issues, but the policies go the other way. So because it's different who's in the negotiation table, and I think you rightly put it that those who are in the negotiation table should really think about health and what it means for the health of the people. And I think we have seen this in the past, and that's why I think, Marla, that's why I was really adamant about global health diplomacy. Our diplomats have to put health at the center of negotiations, and not think about other. Of course there are all these things, but it really affects health. Like whatever migration policy, it will affect health. Whatever diplomatic policy, it will affect health. And so health has always been in the back uh, back part of the negotiations. But until
True, true.
COVID-19, I tell you, post COVID-19, everyone, I think, would always think twice and really see, it's time to really fix our health system. with the universal healthcare law. And I think with the recent Mandanas ruling that was mentioned by Sir Willie, this should go. We should capitalize on these gains and really try to focus on the health system, because at the end of the day, it should be a universal healthcare, not just for our OFWs, not just for a special group of population for the aging. I mean, the joke now is that everyone wants to be in the special lane and no one wants to go to the regular lane. But universal healthcare will not work if everyone will be in the special lane. If everyone will go in the OFW lane, the senior citizen lane, it won't work. We have to make it universal, regardless.
Yes, indeed. I think the pandemic has really made us appreciate, what we have heard over and over again when we were young, that health is wealth, and it truly is, because even the very ability to be able to breathe without any instrument, we see that now, within the context of the pandemic, as something that we have to be very grateful about. But also, I think what you mentioned, Doc Joel, is that particularly when it comes to our healthcare system, our healthcare delivery system, many of the problems have been there. And what the pandemic has done is only to highlight what has been there also all along. But also, I think what the pandemic has also maybe contributed to is that in the lenses, when we are talking about migration, we have to have a health lens. And also when we are talking about health, we also need to bring in a migration lens as well. And especially now, because we had been so used to thinking of the world being very mobile, and then suddenly we have all been rendered immobile because also of the virus. So what was also mentioned earlier about the whole of government approach, a whole of society approach that would also involve not just government institutions, but ordinary, all of us, as citizens, as members of society, to be able to contribute to what can make our communities, our country, the world as safer and healthier to live in and to move in, as we had done in the past. There were some questions that were given to us, but I think some of them have also been addressed earlier. And so perhaps I would just like to ask from our speakers and our discussants if they have one key message that they'd like to leave our audience and participants with. I don't know, maybe we can start with Yas. If there's one key message that you'd like to leave with us, and then we all after which we move to the closing part. Yes, may I
Sure.
invite? Yeah.
Yeah, I mean, thank you so much for everyone's presentations and for the reactions from our interveners. I don't know if that's an official term. I think my main comment is that I completely agree. A lot of these policies were created in the context of emergency. We had limited information. We had implemented some form of maybe mission critical skills before, but this is a completely different context. I think my main point is that whatever these emergency measures were, they had long-term effects on professionals who work very hard to fulfill their migration aspirations. Like it's thousands of pesos down the drain, it's years of work. And so, I mean, I completely agree that in macro sense, we learn from our policies, but let's not forget there's a high cost to not having nuanced enough policies that really take into account people's lived experiences.
Thank you, Yas. May I invite Kat? She has a
Hi.
core message that she'd like to share. Yes.
Yes. So siguro to really just emphasize the importance of what you said, Doc Marla, no, on health is wealth, I'd also like to share with everyone that mental health is also part of your health, and it's a very vital part of everything. So please take care of your mental health as well. Thank you.
Okay. Thank you, Kat. Jure?
Well, thank you to everyone. Arigato gozaimasu to our Japanese friends and to Itaru-san for bringing us together. I guess I think we now know where we are. I'm happy to hear local governments through planning coordinator, the veteran Willie Prilis, for telling us and for reminding us of the struggles that they continue facing. I think that is something we're still trying to grapple. And even with the Delta variant coming and probably with an Epsilon variant coming, I think there's nothing wrong with us thinking beyond those variants and probably prepare for a future when this is all over. I think I said something earlier that the recovery will not be immediate, and so that we could put a smile into our faces, probably as a nation and for overseas Filipinos and for the stakeholders we have here. Let's prepare for a post-pandemic scenario so that we could have a more hopeful future. Thank you.
Thank you. Sir Willie?
Yes, maraming salamat po again. Thank you for everyone, my fellow speakers. My main takeaway continues to be the same, that in the battle against pandemic, we're all in this together, local governments and national government agencies and our partners in the civil society, as well as the professional sectors, together with our citizens. Um, will be able to come up with better outcomes if we work together in trying to contain this challenge. We are still hopeful that the innate resilience of the Filipino people will triumph at the end of the day. But just the same, it's not an excuse for us to
Yes.
keep on relying on that on that worn out adage that the Filipino is resilient like the bamboo. There are lessons to be learned, and we should learn those lessons well. And again, the message is for us to be working together to make that thing happen.
Thank you. Indeed, no, we are resilient, but we also want to move beyond resilience and have our institutions work for us. Doc Joel?
Thank you, Ma'am Marla. I think for me, I'd just like to highlight what you have mentioned about, I mean, post COVID era, that we really have to emphasize in terms of advancing health in the migration discourse, and also migration in the health discourse. I think these are two, one cannot do without the other. And I think it will be, if we put health in migration and migration in health, that will be really the way forward. Thank you.
All right. Thank you, Rick, my
Yes.
my very good co-host. You also have some takeaway before we move on to our closing remarks.
Yes, Marla, first of all, thank you for making me your co-host. At least I will not be so idle, no? And my takeaway, whatever is said, I just think that there's nothing useful when people are sick and dying, no? So therefore, to me, governance must be all centered on health, and development planning and development work as well. No, and specifically, I share my dream that there will be more hospitals in the local communities that are technologically equipped and pay good salaries for our health workers, and that we promote nursing education and healthcare profession, because even before pandemic, the World Health Organization already has declared people will live in their hundreds, and we need caregivers all over the world, and that is where we are good at. We have a young population. Let us not be hypocrite. Let us conquer the world with opportunities. It's not about labor export, no. It's our own development contribution to the world. So that's what I think I wish can pervade in the next few years. Thank you, Marla.
Okay, Rick, maraming salamat, and I'll see you again later. So for my part, I really just want to thank everyone for their presentations and for the discussions that went on. I'm sorry that we had to extend a little bit, but I hope you'll agree with me that the discussions have been very rich. No? So thank you. And now it's also my pleasure to introduce another colleague for the closing remarks. He is the partner of the Scalabrini Migration Center in doing this webinar. And I'd like to introduce Dr. Itaru Nagasaka. He is professor of the Graduate School of Humanities and Social Sciences at Hiroshima University. He has done his field work. He began his field work in the Philippines way back in 1992, and I always want to introduce him as a Japanese who can speak Ilocano. No? But of course, since then, he has continued to work on the area of migration. And he is heading the project, the larger project that I told you about. And I'd also just like to mention that one of his very interesting publications is the book Mobile Childhoods, which he co-edited with Asuncion Fresnosa Flot. So, Itaro, may I call on you for your closing remarks?
Thank you. Can you hear me?
Yes,
Okay.
yes.
Thank you very much for your introductions. I'm Itaro Nagasaka from Hiroshima University. At first, I would like to show our appreciation to our speakers today and for their very timely and stimulating presentations, and also to discussants for their very insightful comments. Yasmin talked about the pivot of migration policy. That was really interesting during the pandemic and its effect on the individual migrants. And Kat talked about the significance of the activities of the civic organizations like Ugat to the mental health and the well-being of the migrant workers during the pandemic. So I was very impressed by the Kat's presentation because as residents in Japan, I sometimes talked with my Filipino migrant friends, and some of them have problems with the mental health. But as Marla talked about, Marla mentioned that they want to speak with their language. So I'm wondering if how we could provide the support to these migrants when I heard Kat's presentations. And also the Jeremiah touched on the responses of the local governments to the reintegration of the repatriated migrants during the pandemic. That was really important case studies. I enjoyed a part of his presentations about the case of the San Nicolas because as Manuel introduced, I observed the development, economic development, and also the development of the real property industry in the San Nicolas during the 21st century. So I enjoyed that presentation very much. And perhaps from these presentations, we could understand the need of multi-dimensional and multi-layered analysis to understand the complex relationships between the pandemic and the migrations. So thank you very much for your very great presentations and also the insightful comments. And as Malula introduced at the beginning of this webinar, we have just started an international collaborative research project on the experiences of the pandemic of the Filipino migrant workers living in the different countries, namely Japan, France, Belgium, Canada, Netherlands, Italy, and the UK. We plan to compare different experiences of the pandemic of the Filipino migrant workers in different countries. In this collaborative research project, we decided to organize the webinar series, the first, in cooperation with the Scalabrini Migration Center. about migration and the pandemic. Today's webinar is the first webinar of this series. So we are planning to hold another couple of webinars. So we'd like to provide the forum, a kind of the forum to share the research findings and experiences presented by the academics and practitioners and the migrants themselves, if possible. So I'm hoping that the many participants today will join again the next session of this webinar series. Okay, so finally, I'd like to express my appreciation to the staff of the Scalabrini Migration Center to successfully organize this great webinar, particularly the Dr. Marlo Assis and also the Mr. Ricardo Casco. They organized this first very interesting webinar. And I'm also very thankful to the technical support staff of the Scalabrini Migration Center. Okay, so finally, thank you very much for your participation in this webinar, and I look forward to seeing you again in the next webinar. Thank you.
Thank you very much, Itaru. And with that, we say goodbye to everyone. Thank you again for tuning in, and we hope that we will see you in the next webinars. And please keep safe. Thank you.
Thank you.
Bye.